Senator John Thune is chairman of the Senate Republican Conference. Senator, good to have you here this morning. Welcome. Good to
morning,
see you.
Martha.
So we're getting sort of signals in the tea leaves here about which of these nominees are likely to have fairly smooth sailing. General Mattis appears to be in that category, and you can tell me if you agree with that. But it looks like Tom Price may be in for a fight.
Well, I think the Democrats, they would love to slow down President-elect Trump's appointment of nominees and getting them confirmed into these positions. But we're going to move very quickly to confirm Tom Price and the other nominees that he's put forward. I think these are people that are very qualified for the positions they've been nominated for. Tom Price has enormous experience as a physician, also as a member of Congress who's been a leader on health care issues, and is ready to roll up his sleeves and get to work to try and repeal and replace Obamacare with something that works for the American people. So we're anxious to help him get into that role. The Democrats can try and throw roadblocks up, but because they changed the rules 2 years ago, he will be confirmed at 51 votes, and so that's going to happen.
And that was the rule change that Harry Reid himself came up with, which now is going to make it very difficult for Democrats to keep anybody off of Donald Trump's cabinet. Is that right?
That's correct, and I think they may rue the day that they did that, because
and they were warned about it at the time, as I remember.
Well, we were, and we at the time, obviously, they used the nuclear option. They broke the rules to change the rules, and so that they could get some of their nominees on the courts. But they also changed it for executive branch nominees, and those are the rules. The rules we're going to play by. It's going to be 51 votes, and that's going to make it a lot easier for us to get these people into their positions quickly.
So in terms of Tom Price and Medicare, is it truthful to say that he wants to eliminate the program, as is being said on some websites this morning?
No, I mean, there's just a lot of crazy talk out there, Martha, and I think people just need to accept and realize that there are a lot of people who are very concerned about the outcome of the election and want to muck things up as much as they can around here. And so there's a lot of just rhetoric out there that is completely unfounded, and I think people need to accept that for what it is. Tom Price is somebody who wants to make Obamacare, or wants to make a health care system work in this country, which means getting rid of Obamacare and moving to a new system that has more choices for parents, or I should say for patients, more flexibility for businesses, and hopefully more control for doctors and patients than what we have today. These ideas that are being proposed out there are just crazy, and I think they need to be treated as such.
Well, Donald Trump said on the campaign trail, I'm not going to cut Social Security, Medicare, or Medicaid, and that every other Republican is going to cut them. So if there are changes to be made, do you think that can be worked out, given what he said when he was running for president?
Well, President-elect Trump has made statements on the campaign trail about some of these programs. Obviously, we all believe in Social Security, Medicare, Medicaid. They're safety net programs. People depend upon them. But like any government program, they can work better and more efficiently. And some of us happen to believe that we've got to reform our entitlement programs to make them sustainable, not just for people who depend upon them today, but for future generations of Americans. And so I hope we can get into a discussion, frankly, of how we can make that happen. But I think the reality is that starting out, the first thing out of the gate when we get back in January is a vote here in the Senate on a resolution to repeal Obamacare and to move toward replacing that in a step-by-step way with health care insurance solutions out there and coverage that really work for the American people. And we may have a discussion about entitlement reform at some point, but first out of the gate is going to be Obamacare repeal, and then the process of replacement, getting a new Supreme Court justice on the court, tax reform, getting the economy growing and expanding again. There are a whole range of things that we think are priorities, and at some point I hope we deal with the issue of entitlements.
You guys get a lot of rest over Christmas holidays
and
the break.
We're going to need that, yeah, that's right.
Because it's going to be pretty busy for you and for all of us who watch this process and report on it. Senator, thank you very much. Good to see you, sir.
Great to be with you.